So today I'm going to be reflecting on experiential learning and clinical debriefing as part of my transition to a fully qualified paramedic within Australia. The benefits of experiential learning and clinical debriefing is an important concept for further developing skill sets in the healthcare fields. Theoretical knowledge on skills within an occupation, such as paramedics, does not allow someone to be able to perform all the tasks to the correct standard. Experiential learning is practicing and experiencing individual skills in simulation settings or on the job or placement will allow for a paramedic to be able to better understand by learning from their experiences. That's from FitzGerald et al. 2012. From a personal experience of this, my own understanding and ability to complete the roles of paramedic, I have achieved a better understanding and a better ability to put into place the skill sets of a paramedic while conducting placements with the Queensland Ambulance Service. Linwood 2007 supports my view that more learning is done on placements and in on-the-job experience. Leading into this, clinical debriefing goes hand in hand with experiential learning. Debriefing on a scenario or a case is an important way to understand what went well and what needs improvement. And Corbett et al. 2012 talks about the importance of clinical debriefings and the lessons learned from them. Taking time after completing a case to analyse allows for an individual or team to understand what their strengths and what their weaknesses are and what needs improvement. In a scenario-based environment like the ones I've completed at university, this has been beneficial as multiple people are watching what is going on. However, in an actual case environment such as on placements or in the future when I'm working as either a GPIP or similar around Australia, it is limited to who's working the case, but it is just as important, if not more so, to reflect either at a personal level or within the team who is working the case to understand how the case went and how I'm progressing as a professional paramedic. I previously experienced the benefits of both experiential learning and clinical debriefing in a medical type role, as well as similar experiences in non-medical type roles. This was during my time in the Australian Defence Force. During my time there, I was trained up to be a combat first aider as a secondary role to my primary job. As part of that training, and a part of being employed in that job, we would do a lot of scenario-based training and always have to do a clinical debriefing post. This was done at least every 12 months to maintain my qualification and maintain our skill sets. The scenarios that we trained in were always as realistic as possible. With some of the bigger scenarios, we had professional role players and movie quality makeup and effects to enhance the training with the realism and amputated limbs, severe burns, as well as other things like simulated car crashes and simulated explosions. To simulate real-world scenarios and allow for greater experiences to be gained. Moye et al. 2007 has researched and documented that for learning about integrating of skills and knowledge, experiential learning is best, whether in a scenario which is well thought out and realistic, or on-the-job training. Similarly, in Afghanistan, I was employed as a combat first aider as my secondary role, and as part of this, I assisted medics in various cases. And after any of our cases, whether they were just being an individual person or some of our more hectic cases, so to speak, of mass casualties from IED blast or car crashes or contacts, we always conduct an after-action review, which is similar in the styles of a clinical debriefing used by health professionals in the civilian setting, but with a more military-styled focus. These were important to work out what was working well and what wasn't working better to prepare for future situations. The findings we discovered from this allowed us to further develop our standard operating procedures from the medical perspective, and this reflected on whether we were operating in a secure medical area, whether it's a combat outpost, forward operating base, or in the main base of Tower and Count, or whether we were operating outside the wire. After these debriefings and cases, we'd work out what we needed to retrain on and what we were doing well at the time, and focus on that retraining to ensure we were at the best standard possible. Like I previously mentioned, experiential learning has been a big part of my previous career with the Australian Defence Force. Not always focused on the medical side of things, but in my day-to-day job as a combat engineer. Learning as I was going was always a big thing for me. And this will link into my future career as a paramedic. Learning on the job is what works best for myself. I'm more of a hands-on learner and take more away from practical training or doing the job itself. My previous experience within the ADF, as well as on placements, has shown to me that I always pick up and expand my skill sets more after on-the-job training or placements due to that experiential learning. I believe this will make me well suited to further develop my skill sets from a university graduate to a qualified paramedic, as I will be constantly exposed to new things and rehashing and reperforming my day-to-day job. While on placement with the Queensland Ambulance Service, I've taken what technical education with a limited practical application and practical experience and learnt how to apply it in real-world cases, in the real time, off my own head. I believe that I have taken more out of placements than the scenario-based training at university, yet more out of the scenario-based training than just going over theory stuff in lectures, as it allowed me to put the skills I've been taught into practice, see what works best for myself, whether it be my communication style, or do I complete tasks such as vital signs and interventions, or simply improving my own systematic approach. Learning to tailor my own personal practices from observations of qualified paramedics completing their jobs and completing tasks, or from mistakes I've made during my placements as well, or scenarios, and learning from them. Once I transition into a graduate style program under mentorship and working the job, I believe my skills within the paramedic role will increase significantly and become more efficient in both performing interventions, making clinical decisions, and communicating with patients and other health professions. This will be from the experiences and new settings I'm exposed to constantly, and will be enhanced by the time I spend either reflecting myself and doing my own clinical debriefing, or as part of a clinical debriefing from the other people I'm working with. I base this on my previous exposure and placement, and after each placement my skills had increased to match my theoretical knowledge. Post completing an internship, whether that's 12 months with the QAS or one of the other similar programs around Australia, I believe I'll be at a better level due to the fact that all that exposure and experiences and debriefing will help balance my level of knowledge with my actual ability to perform all the jobs and understanding them in a real world scenario. Most parts of the paramedic skill sets do suffer from skill degradation if they aren't put into practice regularly. This is where, in my opinion, completing a clinical debriefing is important, whether it's scenario setting or a real-time case, as it allows for identifying these skill degradations, allowing them to be taken care of before they become an issue in affecting my ability to perform as a paramedic. This also allows for a continual improvement, especially in some of the more intensive jobs, whether it be high level of trauma, cardiac arrests, or any job really. As a future paramedic, experiential learning is important and is the main reason I believe that graduate induction programs in the QAS and similar internship programs around the country are used. And tied with that, clinical debriefing in cases with fellow paramedics will be an important part of developing into a professional paramedic, ensuring continual development as I go along my career as a paramedic. So in summary, both experiential learning and clinical debriefing will be a very important part of my transition to become a paramedic due to the fact that it's how I will learn to put all my skill sets into practice, and how I'll learn whether or not I'm improving and what I need to focus on to maintain my skills and further develop as a professional.